Hello, myself Mayur Shinde. I am here to talk about suicide cases during lockdown. Recently, means from 4 months, we are having lockdown in our country as well as in the world due to the COVID-19. So I will talk about suicide cases during lockdown. The number during lockdown has increased in some states, while in some states it has decreased. If you take in Maharashtra, the number has recently increased in the lockdown. In 4 months, nearly 300 cases of suicide has been noted. In the early stage of lockdown, it was mainly due to the ban on alcohol or something like that. After that, after 2-3 months, due to stress, anxiety, people were having suffering from depression, and so they committed suicide. And from the last 1 month or something, people have means due to poverty and some other reasons, they are committing suicide from many other reasons. Apart from Maharashtra, in Ludhiana, there are also many cases, nearly 150 cases of suicide. But in Chandigarh, there are only 28 cases of suicide, and in general in Punjab, the number of suicide has decreased during the lockdown because it doesn't have many reasons, but some one or two reasons about this are that in lockdown means the debt given by the banks or the installments, the farmers did not have to pay the installments of the bank, and the loan also, nearly about 1 to 2 lakh loan has been, nearly the loan was paid by the waiving by the government was done, so the farmers did not have to pay that also. And in if we take in Maharashtra, nearly 300 cases are already there, but in Pune, the biggest hospital of Maharashtra, I think Pune is already having many patients of COVID-19. But in Pune, the situation of COVID is means there are many patients, but still they started a helpline for the people, means a helpline for the people who are facing anxiety, depression. They started a helpline, and nearly means about 3,000 calls still now have been recorded in that helpline number. So every day many calls come to that helpline number. People speak about them in depression, anything they want to speak, means though we are having video call conferences, but still the face to face conversation is very important for every one of us. So people face depression because we can't speak what is in our mind and all that. So people call on that helpline number, they tell about their problems and all, and the person sitting there, the doctors, the psychiatrists, they help them by giving solutions to them or by how to indulge their mind in other things and all. So, lastly, I would want to say that there is means no problem has a solution like suicide. So we should not think about suicide as well. Committing suicide is other way, but we should not think about it as well. If we think like that, if everyone has many problems, but still we should talk to our friends, our family, and no problem is greater like that, that it is beyond about our family. So we should talk to our family, friends, and definitely we find a solution for it. So thank you about this.